All right, now we're going to transition into our second overall strategy, and that is looking at collective impact and how it can become a part of the asset base of this work. I'd like to introduce our panelists, and again, these are just very quick snapshots. I encourage you to look through the extensive bios that are within each of your packets. We're very fortunate to have a very rich and deep pool of talents who are sharing their time and their thoughts with us today. All right, our first panelist is John Hancock. John is Executive Director of Junior Achievement, and John will be talking about a statewide effort they've undertaken to understand and improve Oregonians' financial peace of mind. I'd like to also introduce Bobby Cochran, Executive Director of Willamette Partnership, and Emily Help. Did I pronounce that correctly?
I just didn't hear you, but I'm sure it was just fine.
Okay, wonderful. From OPHI, the Oregon Public Health Institute, who will be talking about their work in their Oregon Health and Outdoors Initiative. Our third set of panelists are John Sweet, who is Coos Bay County Commissioner, who will be talking about the Ready to Smile in Coos and Curry County program, and Melissa Freeman, who is with the Oregon Community Foundation, speaking about OCP's support of that work statewide. And Jeff Todal, who is Director for the Center of Prevention and Abuse and Neglect at the University of Oregon, who will be talking about the efforts within Lane County to reduce child abuse by 90% by the year 2030. And our moderator is Lillian Shirley. Lillian is Director of Oregon Health Authority's Public Health Division, and she knows all too well the challenges and complexities of transforming the health care for entire populations. She's also somebody who has devoted a significant part of her career in supporting the needs of underserved children, both in the county and the state. Welcome.
Thank you so much, Michael. We are honored to be here. We're honored to have all of you joining us today. We have a panel here of people who are actually trying to struggle with implementing the work that we've been talking about since Dr. Robertson identified some of the really significant areas that we can focus on together. I particularly liked his slides with all the arrows going in different directions, because we know many of us care deeply about Oregon and Oregonians, and we're working really hard, and there's a lot of activities, but we also know we're not getting the outcomes that we want, and this is our opportunity. So I'm just going to talk a little bit about the Oregon Health Authority, because we touch virtually everyone in the state, and through the Oregon Health Plan, the Public Employees Benefits Board, the Oregon Educator Benefits Board, and in my shop, the Public Health Division. And we do this in cooperation both with county and local governmental public health, as well as not-for-profit agencies. We have enormous amounts of data that will inform our collective efforts and make sure we are all doing our part in getting the results and focusing on those outcomes, particularly in addressing, which I think Dr. Robertson did a good job of pulling out, addressing health disparities and promoting wellness in every community across the state. And some of our communities are isolated. We have rural and frontier communities, and access is a huge issue for some of the issues that we're trying to achieve here, and you'll hear about from our panel. That being said, I'm just going to ask you all to bear with us. We've got a lot of people talking on really important things here this morning. So no matter what medical providers do to provide great care.
I'm not trying to get familiar with you, but I think everybody's going to want to hear you. I am trying to get familiar with you.
Michael's one of my heroes since I've moved here. Thank you. Okay. So what am I supposed to do with this?
That's for them.
All right. So I'm going to start. No matter what medical providers do to provide great care. How's that?
Lily,
Hey, that's
turn
right
it up.
Huh?
It's face down. Turn it up.
Aha. Hey, this is a musical venue. So
We should get to start the clock over.
we won't achieve our shared goal of being the healthiest state if we don't work together. And no matter how brilliant our current efforts are, this is not something we can solve on our own, and we know that. We need to harness our collective power. So our panel today will be answering a couple questions that I'm going to challenge them because they are doing brilliant work individually. And I'm going to kind of try and challenge them to tell us a little bit about how they are trying to achieve this. So my first question would be to all of you, what problem are you trying to solve in your work? And how do you see your problem really contributing to a shared agenda as we've defined it through this morning's activities? So I'm going to start with John here. Okay.
Thank you. Good morning, everybody. So I've been participating with a group of private sector industry professionals and nonprofit executives and academic research and design people on the cohort related to financial peace of mind for Oregonians. And as Dr. Robertson framed this morning, financial well-being is one of the 5 elements of overall well-being in the Gallup well-being organization's framework. And so the financial well-being is defined simply as managing economic life to reduce stress and increase security. So as he pointed out this morning, we rank 28, so we're in the bottom half nationally. And despite lots of organizations and initiatives trying to have positive effect on the larger quality of financial life, we're very disparate in our attempts, pretty isolated, and there seems to be a lack of comprehensive understanding about exactly what it means in a practical way. What we do know is that, based on the work we've done so far, is the stressors and the lack of security tend to come from things like unemployment, medical emergencies, education-related debt. Of course, there's a lot of conversation about debt for young people coming out of college, credit card, consumer debt, all these kinds of things, basic lack of financial skills. So we're trying to address a lack of or a compromised sense of financial well-being for Oregonians.
Excellent. So, Emily? Okay.
Hi,
Emily
thank
and
you.
Bobby, yeah. How does that resonate with what you're trying to do and achieve in your area?
Yeah, so thanks so much for centering us on the equity question. I really appreciate that. And our problem is what we've heard today and what we're talking about right now, which is that Oregon has huge health inequities that we really need to address if we're going to become the healthiest state. And we also have evidence that going outdoors is good for health. And this connection, though, is not explicit in the minds, programming, or messaging of organizations in either the health sector or the outdoor sector. And the benefits that evidence is telling us about aren't available to a lot of our most vulnerable communities who we really need to be focusing on if we're going to be doing equity work.
Yeah, I think that's exactly right, Emily. And for me as Willamette Partnership, I'm not a health guy. I'm a conservation guy, and so I brought my plant, and so you have that here. We can name her later, but the evidence is out there that you kind of imagine this is a sequoia and you feel that awe. That's a biochemical response in terms of cortisol levels that are going down and staying down for several weeks after you see that. We're seeing that if you plant trees, you're able to reduce air pollutant exposure by 10% for 150,000 people in Washington County. And so that base of evidence is real. And so part of working with Oregon Public Health Institute, Willamette Partnership, Portland State, Oregon Healthiest State, the Intertwine Alliance, and many, many others was figuring out how can we develop an Oregon Health and Outdoor Action Framework that takes this kind of feeling that we get when we're around nature and make that explicit. And so this morning we launched the Oregon Health and Outdoor Action Framework, and so you can kind of check it out at oregon.healthandoutdoors.org, and we'll talk a little bit more about that this afternoon.
Okay. So, Commissioner, you're in an area of the state that has a number of access issues. And would you and Melissa talk a little bit about how you see the work that you're doing contributing to the overall health and wellness of the people that you serve as a county commissioner?
Thank you. I'll give it a try. Well, it was about 10 years ago The subject that we're going to talk about here, Melissa and I, is children's dental health care. About 10 years ago, I was involved with the Ford Family Foundation, and we challenged the citizens of Coos County to provide us with things that we could do to really help them. We had, I think, some 40-plus leaders from Coos County, educational leaders, healthcare leaders, public sector leaders, law enforcement leaders, business leaders, and we asked each one to list 3 areas that they thought the foundation could best help the county. The first most frequently mentioned issue was meth. The second most frequently mentioned issue was children's dental care. So from that, my answer was really simple. At the time, the foundation had just invested in 2 dental vans, and one of them was underutilized. Well, we'll just send that dental van over to Coos County and take care of this problem. Well, I was told very quickly that this problem is kind of like our national energy problem. You can't drill your way out of it. You've got to have something way more than that. You have to have a preventative piece. You have to have an educational piece. So this idea kind of simmered along for about 5 years. Not quite that long, about 3 years. And the Oregon Community Foundation then challenged different areas of the state in which they have leadership councils to come up with a major problem for that region, to identify the problem, to find an answer, and to implement that answer. And they gave a good deal of money to help meet that challenge. So we narrowed what we wanted to do in Coos and Curry County down to children's dental health, and then what to do about it. It's a big area. Well, even though we had what we thought was a lot of money to work with, when you really get thinking about attacking this issue, it really wasn't all that much. So we decided we had to focus our efforts. And what we ended up with was that really educational and sealant fluoride varnish program. We tried to figure out, now how are we going to do this? What age groups do we attack? Well, we found out that as far as sealants go, the most important age groups are in the 1st and 2nd grades, and then again in the 6th and 7th grades when the permanent molars come in. And if you can apply the sealants at that time, you have a good chance of reducing infection and cavities. So that was all good, but now how do we get to the kids? Well, first thing we noticed was there were a whole lot of kids going to the dentist. So that wasn't a good area to try to get them. So we figured, well, the kids are in the schools. Let's see if instead of taking the kids to the dentist, we can bring the dental care providers to the schools. And so that's kind of how our program got started. And it has increased over time. The first year we started the program, I think we had, got the numbers here, we were active in 11 schools in the 2-county area. We screened about 800 kids. This year, the program has grown and expanded. And with that comes some issues, by the way, but we won't get into those right now, where we will be serving about almost 7,000 kids in 23 schools. And again, the services we are providing are dental screenings, sealants, education, dental kits, and then follow-up activity to get these kids who have dental problems to a dental care provider.
Great, thank you. Melissa, do you want to just expand a little bit and talk about how you see that work contributing to a shared agenda as we go forward?
Sure. Thanks for the opportunity to talk about oral health. Most of us have probably never seen what a mouth really looks like when it's bombed out, and the pictures that we saw and the kids that we started hearing about have, many of them have rampant decay. We're talking about 17,000 kids in Oregon that have black nubs for teeth. They have 7 or more teeth that are infected. And so the beauty of collective impact on an issue that you can pretty quickly understand is a real win-win. And so from my perspective, Ready to Smile is a program that we have been working on now for 6 years. And thanks to the support of the Oregon Community Foundation's Board of Directors, we've been able to now turn this into about a $3 million initiative, a 5-year initiative for the state. And what we're trying to do now is replicate the model in 15 different areas. So in terms of shared agenda, I mean, this is the work of the foundation, our volunteers, our community-based organizations, dental care organizations, schools, and public health experts. And without everybody coming together to serve all kids in their communities, we wouldn't be successful. One thing I'd just like to say as a sort of a growth of the work on children's dental health is the formation of the Oral Health Funders Collaborative. So groups like Northwest Health Foundation, Kaiser Permanente, Providence Health and Services, the Ford Family Foundation, all of us got together back in 2011 to form the Oral Health Funders Collaborative where we could share information. And more members have joined us. And what that's enabled us to do is put together a strategic plan in partnership with the Oregon Health Authority, the Oregon Oral Health Coalition, and come to agreement around a set of strategies and objectives to do 3 things, really. Improve the infrastructure for oral health in Oregon, improve prevention services and systems of care, and improve the workforce capacity. So we're on the Oregon Community Foundation's website if you want to learn more. It's not a place to get funding, but it's a group that's working on policy and projects that will help address those 3 challenges.
Great suggestions, and also suggestions of where people can find things that they can hook into for their own communities. Jeff, you are a leader in an extremely difficult area that we all feel great compassion for, families that are experiencing abuse and neglect. How do you take this really, difficult issue and get us all engaged in understanding what we can do in our own spheres to make sure that going forward, Oregon doesn't have this problem?
Yeah, thank you. Yeah, it's a very difficult thing to do well. And collective impact is a strategy that we've identified and adopted mostly because we think it's important to be inclusive. And I can't emphasize that enough, the importance of deeply engaging our community. So we've worked hard to think about who's involved in the decision-making, who's at the table, and who decides. And so we've spent actually 2 years really trying to get more clear about how do you significantly reduce child abuse and neglect in your community. So we've identified Lane County specifically as the region in which we're working. And so we've spoken with over 5,000 Lane County residents in the last couple of years, asking them, imagine it's December 31st, 2030, and you've reduced child abuse and neglect 90%. What did you do? And what do you need to do right now? And that's been our emphasis. We've taken 2 years, and we've included a range of people who've tried to be as inclusive as possible. And being inclusive isn't just a good thing to do, it's the only way to be effective. And so we've worked hard at trying to be inclusive, and there's not time to talk about all of how we've attempted to do that, but that's the conversation I'd like to have.
Okay, great. I'm going to come back here, John, and we were just talking about inclusiveness, and can you talk a little bit about how your efforts are focused on making sure the communities are part of the solution? Because pretty much in the room, we're mostly the people who are working on the arrows, and it seems that bringing things together has to be focused on the community and how that community wants us to organize our arrows. So can you talk a little bit about that for your work?
Yeah, sure. So our cohort has been active for 6 or 7 months, meeting on a monthly basis. And the format that we've used really in educating ourselves, which has been much of the bulk of the work in these early months, has come from accessing organizations, public sector, private sector, nonprofit sector, who are doing all kinds of different work in communities. And so that's the extent to which we've accomplished that. We have not reached out to general populations, and frankly, I'm not sure if we know how yet to do that, but we have reached out to organizations that are working with general populations. Two things for sure have emerged from the work. Number one is this notion of lack of financial security and well-being seems to cross all economic, socioeconomic backgrounds. So that's interesting. I mean, I think sometimes we make the assumption that if there are people of means or who are gainfully employed that they have security. That's not the case. Now, the reason that's true is different than for those folks who have insecurity because simply of a lack of employment or underemployment or lack of access to various services that could bring greater security. So we're trying to get our head around that, and we're trying to come up with metrics that we could commonly, not only across all the different cohorts, but even within our own cohort, where we have many different kinds of organizations, figure out what a shared agenda would look like and what shared common metrics would look like, because at this point, we're a bit isolated in our impact.
Well, it is a journey. We're here because we know we're all on a journey together. So can we talk a little bit about, about metrics? Like, how will we know we've done what we set out to do in your areas?
Yeah, I can talk a little bit about metrics, but I think, Emma, the importance of equity on this is really important in kind of community leadership. I think that's something we heard really squarely, is that if we're going to get more people outdoors, particularly for generating health benefits on mental health, physical activity, social cohesion, that you have to empower communities to do that. And like Emily and I are not the right people to be up here next year. It'd be much, much better to have different people up here. And I think that's how we've organized ourselves as an initial planning committee to step back into more of a supporting role for communities. And I think overall on metrics, we know the evidence, again, links to improved physical activity. Being outside, you don't have to talk about exercise. You just are more active. Mental health, you have improvement in measures of brooding, kind of depression. And then social cohesion, better relationships, and then also improvements in air quality.
Okay, great. Hey.
Thanks, Bobby. Yeah, when we were putting together our action framework for how we were going to bring health and the outdoors closer together, working together, we not only worked with a core team of the partners that Bobby mentioned earlier, but also convened a multi-sector group of advisors from across the state who really told us that if this is going to work, and if this is going to work specifically as an equity strategy, communities really need to lead. And communities need to lead not only the projects that are happening in their communities, but they also need to be at the table where we're planning this. And they need to have representatives there helping us design programs and projects that are actually going to work in their communities, because our communities throughout the state, as we've heard today and as we're continuing to hear on our panel, really are the experts on why the current system isn't working and what it's going to take to fix it.
Okay, thank you. John and Melissa?
Well, regarding community involvement, as we got into this children's dental care, we realized that we had some silos that we had to break down. It required the involvement of the schools, at least the program we offered up did. It also required the involvement of the dental community. The schools, their silo is academics, and we had to show them that it needs to be more than that. Children cannot learn if they're not feeling well. If they're hurting, they can't learn. And many of the children with rampant tooth decay just weren't able to pay attention in the classroom. So after a lot of meetings, a lot of discussion, we were able to bring the schools into the fold. The same thing happened on the dental side of things. We would ask the dental community, well, what do you do? If you ask 10 different dentists, you'd probably get 15 different answers. And so we had to narrow that. And so that happened. And so over time, the partnership has evolved. The partnership is enlarged. Right now, the dental care organization that services Coos and Curry County, the things by which they are graded largely align with the types of things that Ready to Smile does. So we've been able to invite them into the fold, which has been a great help in making this program more nearly sustainable. talking about inequities, there's one simple or a couple of statistics here. It says that low-income children have higher cavity rates, almost double that of children who come from families that are better off. Untreated decay rates, again, almost double amongst children from lower income families than those from moderate and higher income families. So this program is helping address that inequity because we treat all children the same. Everyone in the school is seen, everyone in the school gets the same, has available to them the same services.
John, I was going to just ask, John, given your topic, and Jeff and John and Melissa, can you just think about when we know that we have people in our community that have inequities, disparities, we have that data, but how can we convince the rest of the community that it is important that we all achieve that level of equity together? I mean, what are some of your thoughts on that as you work on the ground getting that? Because we do know, yes, we're better together, but we have to really convince everybody that we're better together, sometimes with our programs.
Well, I have a good example of meeting with Centro Cultural yesterday, I think it was. And we were talking to them about how you go about replicating this type of model in Washington County, in Cornelius. And the people that we met with were Hispanic, and they said, we are going to be very, very challenged in getting our parents to sign these permission slips if we don't heavily invest in outreach. And the problem is that you're asking us to do outreach at the schools, but the parents aren't going to the schools. So what they were suggesting is that they would have a series of outreach events at the community center where the parents actually do come and participate and enjoy themselves, and that's where they're going to conduct the outreach. And so, that wasn't in our RFP, our request for proposals, but we intend to be very flexible and support their ideas for how to engage with their community, make sure everything is translated, have bi or trilingual people at these events. And we're really excited about that. We're excited to see how this gets replicated in the various communities. And last thing I would say is they're taking the curriculum, the oral health curriculum, and modifying it to make sure that Mexican candies and foods are included in the pictures that they're using to increase the connection with the information.
Okay, great. Jeff?
Yeah, I think the vast majority of people, at least in our community and probably all over Oregon, want equity but are confused about what that actually is.
Right.
And so we did some surveying, I'll just be brief about this, where 98% of Lane County residents, it was matched by Whatcom County residents in Bellingham, Washington, agreed or strongly agreed that the core responsibility of adulthood is to ensure that all children are safe. And so people want that. We also asked, do you think that we can significantly reduce child abuse and neglect, 90% by 2030? And we were surprised, 84% of residents said that we can, 34% said that we will. So people believe that we can, but don't know that we will. And we think that the thing to deal with there is discouragement, and our discouragement about the ability to make social change happen. And we found that as we've been more specific and getting closer to locally derived strategies, people are becoming more encouraged. And so I think a pathway to change is vital to moving toward change that people can believe in.
Excellent. I'm just going to, because you've got at the end of the table there, So let's start back and let me just ask you, so how can we have these mutually reinforcing strategies in place? And because you're the academic in the crowd, how should we measure that together? I mean, the Oregon Health Authority, we have data up the wazoo. How should we analyze it in a way that makes it actionable for this to achieve what you just identified for us?
Actually, I mean this. We can't rely on academics. But I think we really need to listen carefully to people in our communities. And that if the strategy is locally derived, then you get much closer to change in your community. So it's academics have a role, and part of it's about translating what people are saying they need, and translating that in a way that people can identify with and see what I can do in my life to make a difference in my community. I think a lot of it's about translation.
Great, thank you. We're down to 2.25 minutes. Any last thoughts? Part of the challenge here is to get as much input from all of these people who are working around collective impact so that when we do our breakup sessions, people can know who to use as resources and how to incorporate this into the action plans that will come out of our workshops. So any good advice for the rest of us here as we move into the afternoon sessions? Yeah, go ahead.
Yeah, I think just the idea of getting started and having that common playbook is so important. I mean, Emily, we've been working on this intensely now maybe for a year, but with kind of the launch of the framework, which is fairly simple, we're already starting to see the outdoor recreation industry starting to think of itself as public health providers. We've got commitments from REI moving forward on community-based grants. You start to see folks like Portland State and Forest Service committing to research agendas. You start to see the conservation community actually understand what equity means because it's specific in a health context. So as soon as we get Medicaid starting to fund more trees, then we've completed the circle.
Hey.
But I think that's what collective impact can start to do is finding these mutually reinforcing solutions to systematic problems.
Great. Well, John,
Yeah, one
last
last thought.
Okay.
I'll try to be brief. It's kind of a challenge I'd like to put out there. I don't think any of these problems, whether it be child abuse, lack of dental care, lack of good, healthy living styles, lack of financial security, you can go on and on. Spousal abuse, substance abuse, the whole list of the social problems. There are so many holes out there that we don't have enough fingers to plug all the holes in the dike. But there's one, in my view, one key underlying cause, and that is poverty. Now, I don't know what all of us can do about poverty in this room, but it's probably not within our silos, we think. But I think if we don't all take a role in figuring out how we're going to put Oregonians back to work, whether it be here in Portland with your Nikes and your Intels, or in Coos and Curry County with the timber industry and the fishing industry, if we can't keep our people working, we are not going to be able to overcome these inequities and these problems. So beating poverty, reducing poverty has got to be everyone's business.
I think that's a perfect wrap-up. Thank you so much. I'm honored to be here with you all.